you so much. I've learned so much so far. So let's continue the conversation. Is this a safe procedure?
Well, this Tong Ren is non-invasive. It's obviously cost-effective, and it is safe. There's no side effects.
Okay.
So,
do you need to tell your physician that
we highly recommend that people, communicate with their physician. As a matter of fact, we have a letter that we would submit to them to let them know.
Okay.
But we don't diagnose, and we actually rely on Western medicine for the diagnosis.
Okay.
So we want to work in conjunction with. What we do is we would never say to stop a medication. That's for the Western doctor to do. But as the symptoms improve, they would communicate with their family physician, and they would administer what they need to do.
So open conversation on both sides.
Yeah, absolutely.
Now, you were talking about how Tom uses meridians versus points in acupuncture.
Yeah, we with our system is more focusing on the spine, more on the nervous system as opposed to the meridian system.
So
because
back here.
Yeah, typically in Chinese TCM we use the meridian system, which is along the legs and arms, as well as the back. But we focus more on the back because it's the nervous system. We can prove the nerve. Right? We know that the nerve is there and that the nerve sends a signal, as I was saying before about the bioelectrical component. So we focus on that as the hub focus area for opening up blockages. Because when these areas become tight, then that nerve signal from the spine doesn't function properly, and the organ or gland isn't gonna function properly. So by relaxing it, by using acupuncture, we can relax that tension. Again, using Ohm's law to explain it on the body, will then allow that nerve energy to flow to that organ or system.
Okay, so if you're using Tong Ren, do you need to be doing acupuncture?
Tong Ren is on the energetic side.
Okay.
Okay, so one thing that we focus on the energy, but also the physical. So acupuncture and massage is the physical component. The blockages are going to be physical in that we can palpate and actually see that there's pain or feel. So we need to use the energy and the physical both. A lot of energy healers just do energy, and a lot of the physical people just do, acupuncture or chiro or physical therapy or massage.
That's missing
the energy.
So you need to marry both.
Yeah, and then when you do that, you get the most effect. Because with chronic diseases, you're going to affect the cell and or organ with the energy the most. And then opening up the physical blockage allows that energy to continue to stay open.
That is amazing. Now, do you have a little diagram that you could show us in terms of what we're looking at with acupuncture and the channels?
Yeah, well, this is not the channels, but the Huatou.
What's it called?
Huatou.
Huatou.
Huatou is a famous physician about 2,300 years ago, and that's his name, Tou, and Jiaji are the spinal columns. So it's Huatou Jiaji points. And that we use, but we now correlate the kind of like a chiropractic approach, but Chinese approach. And that we use these points along the spine.
Okay.
Just half a finger.
A little bit.
Sure.
Okay.
Just half a finger beside the spinous process are these Huatou Jiaji points.
Okay.
Okay?
So let's say I'm looking at the top of the head.
Yeah.
So C1.
C1.
So if there's a blockage there.
It could cause headache, can cause migraines, pituitary stuff. That's, so when we open the blockages, it's more than just one on the physical aspect. On the energy aspect, we might open up, one or two, but with physical, we might have a couple vertebrae that are, we call vertebral fixation. The vertebrae have to move independently, but when they move together, or they don't move independently, but move as a unit, we're called vertebral fixation. So we want to relax the muscles into the spine so the spine can move freely. So you may have not just one vertebrae, but multiple. So we would needle, C1, 2, 3, for example, for headache.
You could do your own assessment when it comes to Chinese medicine because you're a qualified practitioner.
Yes. Yeah, but I'm not diagnosing. But I would diagnose on a blockage theory. I would say that you have blockages. So, for example, if somebody has a blockage, it doesn't mean that they have a disease.
Right.
But if they have a disease, guaranteed they have a blockage.
They have a blockage.
Yeah.
Okay. So how does the assessment work if someone walked in to see you?
The assessment would be we would listen and obviously ask questions, and then we would palpate. And so we would check the
using
spine.
something else other than that, right?
Yeah, this is for Tong Ren, but we would work on the back. We just palpate, massage. So we can actually feel the tender area. If it's tender, there's a blockage. Pain means a blockage.
And then that correlates to
a specific,
something on that chart.
Right. And it doesn't necessarily mean that you have a disease in that area, but there's tension. It's just physical. So I would palpate from 1 to 10. I'd ask, how painful is it? And they would say a 9. And then I would palpate it. I would needle the area. Let them rest for about 20 minutes.
Okay. And these are some of the needles that you use?
Yeah. And so these are prepackaged sterile needles. We don't reuse. We dispose each time.
Okay. I really want you to prick me. Nick is like, no, I don't want to hurt you off camera. He's so sweet.
Okay, fine.
Okay.
meridian system.
Now, what point is this?
Relax.
So that didn't hurt.
So basically, but this is a meridian system. This is not using the spine. I typically work on the back.
I feel a burn though.
Yeah, that might be from the needle sensation. So basically, we would put it on the back. Okay? And I work on the back. So I check the areas and see how painful it is. If it's a 10 or 9, let's say, tenderness, a needle, let them rest, come back, and you would see it drop dramatically. It could be sometimes a 2 or a 5 out of 10. So that means that the muscles have relaxed, and then I would do a little bit more massage to further open up the tissue that the needle didn't get at. So that's the physical component to open up the blockage, and then the Tong Ren would be working on the energetic aspect.
So you're bringing them all together.
Bring them together, and you get the most effect and benefit.
Now, when the needles are in, are you manipulating them?
You can, I don't.
You don't need to?
No, I just put them in, let them rest. Sometimes I use a TENS machine, like electrical stim, on deep muscles to help, with athletes if they have muscle strains and stuff. But with the back, I don't use the TENS. I just let them rest.
Okay. So
because people sleep. Believe it or not, in acupuncture, people fall asleep. Yeah. And that's what we need to do more and more now is just relax. Mm-hmm. And we find that acupuncture can de-stress people in a big way. They feel just, deeply relaxed or peaceful after treatment.
I know that stress is used a lot when it comes to disease or causing disease, but I mean, is it because we're so uptight? Is it because of the hustle and bustle?
It could be. I think also, we're busy, and we need to find some time to relax. And acupuncture can really get you down into a zone that you really just let go and relax. Okay. So it can be just for de-stressing. It doesn't have to be for a disease
or problem.
No. Yeah, we call it tune-up. We bring the car in every 5,000 kilometers to change the oil.
Yes.
Why not the body?
Yeah, why do we forget about the body and the spirit? Very much so.
I don't know. I know it's something that it baffles me, but
it really does.
I think we need to get the basics and just relax is always a good thing.
How about meditation? We talk about meditation often.
Yeah. Meditation is good. We do that as well. We teach meditation and qigong at the center, and so that can be.
And I remember when you were in last time, you were amazing. I mean, I really enjoy speaking with you. You showed us the cupping. When do you do that?
We can do that on the blockage as well.
Okay.
So
instead of acupuncture or with?
Either or.
Okay.
Yeah. So sometimes we can use a cupping. So sometimes it's more appropriate, like a cold or flu. Cupping is very good. Young children, you do cupping. Respiratory stuff, cupping would be appropriate.
Amazing. Yeah. Thank you so much, Nick, for being here. We'll have you on again, and we'll talk about some other amazing holistic things that you do.
Okay,
You're just fascinating. We